So what are three key considerations for revision lower eyelid blepharoplasty or lower eyelid surgery? Well, we're lucky to do a large number of these from a variety of specialties where they've been done elsewhere. And one of the key considerations is the remaining lower lid puffiness. So as we see in this patient, someone can have had a previous procedure done and they have this residual puffiness underneath the eye. So in that case, we just take our time. Our typical approach for the lower lid is through the inside, or scarless approach, so that there's no visible scar on the outside. This is important to do so that we prevent creating a hyperpigmented or dark scar on the outside there, or conversely a bleached scar, a lightened scar on the outside. So instead we go through the inside and we gently and carefully tease out the excess little fat pads that are still in there, and that just requires patience to carefully dissect through the scar tissue that's there. And then also there's some additional scar tissue from the previous procedure that we just have to carefully take our time to dissect through as we go and press gently on the eye so that the little puffiness will show itself if there's any remaining. Once that's fully taken out, then we can assess the lower lid area and cheek junction. Usually we know ahead of time whether someone's going to need a little bit more volume in that area, but like real estate, it's about location. So the lower lid, if that's puffy, we need to reduce the puffiness, and if the cheek, the upper cheek, and the transition into the cheek from the lower lid is hollow or flat, then we just need to restore volume in that area. And in my hands, the best way to do that is with fat transfer. And then lastly, any loose skin of the lower lid can be addressed by a little bit of laser resurfacing. So those are the three key considerations